A new care facility for the elderly has been officially opened in a special ceremony in Hull. The Jean Bishop Integrated Care Centre will primarily treat elderly patients with long-term conditions who've been referred to their GP as being at risk of hospital admission. Dr Dan Harmon, consultant physician in elderly care, believes the new facility will revolutionise service provision in the area.
What we're doing here in Hull is very different to business as usual, care as usual for older people. Here you've got a combined team of geriatricians, myself included, GPs with a specialist interest, pharmacists, social workers, occupational therapists, physiotherapists, all skilled in caring for older people. And patients and residents of Hull are actually coming here for a comprehensive assessment by the team, a care plan being generated which is then shared across the system so that GPs understand what has been discussed here, the patient has a record of the discussion on ongoing actions. And we've got all sorts of facilities available for patients here, so we've got diagnostic suite, we've got x-rays, in the future we'll have a CT scanner here as well, we can do blood tests, so it really is a one-stop shop where we can carry out that comprehensive assessment and onward plan. Older patients do need care with dignity, respect. We need to understand how difficult it is and challenging it can be to navigate the system. And actually, if you do need to see a physiotherapist, but also a social worker and a consultant, there isn't a better way of doing it than having everybody in the same building. The person doesn't need to attend 3 appointments. There are savings to be had for the system, but more importantly, less hassle for the individual to get the same outcomes.
This new centre behind me sits on the former David Lister school site in East Hull. Its long-term aim is to reduce unplanned admissions by up to 20%. The local CCG forecast that could save up to £5.8 million for the NHS.
There isn't a more needy times in terms of looking at different models of care and innovating. We do have stretched resources, we do have an ageing population. That is a success of the NHS, but we need to think differently and innovate together with our partners to make sure we get future care models right, and Hull will be put on the map via this process through the ICC.
The new centre has been named after Hull's Bee Lady. Jean Bishop has raised just under £120,000 for Age UK in Hull across 2 decades. Well known for wearing her now famous bee costume, Jean says she was delighted at receiving such an honour.
I'm so proud that there is such a word. I never ever thought that it would come to this. I think they made a mistake myself. It's a big important because people should get together, and I think they help each other, and especially if they're lonely, they want to come somewhere and they come, say they came here, then they saw the people, they get together, and that's when they start getting better. You feel a lot better. They don't need a doctor sometimes. It's loneliness that gets you down.
Alan Johnson served as Health Secretary under Gordon Brown's government a decade ago. He praised the joined-up thinking that went into the planning and construction of the new building.
It's getting the organisations that are there to work together, to come together and work together, to share data, for instance. There's a very important thing about IT here, about how you bring these records together. There's no paper in this building, it's all done electronically. And when a patient comes in and they have their assessment is about the adult social care they'll need, kind of bit of physiotherapy they'll need, perhaps their lifestyle that needs to change to help them to live healthier. All of that is all integrated into one service. The reason this is so important is because City Care, with the CCG, local NHS, with the Fire and Rescue Service, with Hull City Council, have worked together to provide this integrated care centre so that the 3,000 frailest elderly people in Hull, who too often are stuck in hospital beds even though they can be perfectly active and don't need to be there, can have a care plan that actually helps them to continue to live better outside hospital. And Jean Bishop is of course the kind of exemplar of that, which is why she was here opening this today.
It'll take a lot of worry out of people, especially the really old ones. I'll find that out when I get on the list.
After years of fundraising efforts for the support of the elderly, Jean Bishop's true legacy will now live on for decades more as part of this new centre in East Hull. Jack Muscutt, Estuary News.